India has reported a new record daily coronavirus death toll. More than 4,000 people have died from COVID-19 in the past 24 hours. Once again, over 400,000 new infections have been recorded. Critics say these official figures undercount the full extent of the crisis. Many fear that religious gatherings are causing the virus to spread even faster.
In some places in India, it is hard to believe the country is in crisis. In the southern city of Hyderabad, Muslims celebrating the end of Ramadan are out shopping, some feeling lax about safety rules. Before forcing regular citizens to comply with COVID-19 guidelines, national leaders and lawmakers need to follow health safety measures themselves. Then common people will also follow them. Many mosques remained shut over coronavirus fears, despite the weekend's Islamic holidays and preparations for the Eid festival. Still, others ignored official warnings and let people gather for prayer in large numbers. Gatherings like these are driving India's second coronavirus wave. It has been much more infectious, partly due to new variants of the virus. As the number of those testing positive surges, so does the death count. Relatives are desperate to get help for the infected loved ones in time. Since this morning, I've been trying to get an oxygen cylinder for my father. The government says there is no oxygen shortage, but look at the number of people waiting here. In 2 hours, you will see that at least 2 or 3 people will leave in tears. Burial sites and crematoriums are overwhelmed. Many are now forced to bring the bodies to makeshift cremation sites instead. For now, India continues to count its losses to the pandemic in more fire and smoke.
And EU leaders meeting in Portugal will focus on relations with India on day 2 of their summit. They are set to discuss the dramatic situation there with Prime Minister Narendra Modi. Bloc members are skeptical over a US proposal, which is strongly supported by India, to waive patent rights on COVID-19 vaccines. While some countries favor the plan, larger EU states are firmly opposed, pushing instead for greater vaccine production. Council President Charles Michel says the US must make the first move.
We don't think in the short term that it's the magic bullet, but we are ready to engage on this topic as soon as a concrete proposal would be put on the table. We all agree that we need to do everything which is possible in order to increase everywhere in the world the production of vaccines.
Let's look at both the European and Indian perspective on this debate. We have DW correspondent Barbara Vessel at the EU summit in Porto, Portugal, and DW Delhi Bureau Chief Amrita Chima with us. Barbara, why won't the EU go along with this US plan on patent rights?
Because they feel that they have been really put on the back foot here. They weren't warned about this initiative by Joe Biden, and the US themselves, they have not exported a single dose for countries in the third world or developing countries. So there is quite some anger underneath the diplomatic formula that you hear here in Porto. The argument is throwing open the patents to negotiate that would take probably until the fall or maybe even into the winter. It would not help anybody at all in the short run. You don't produce a single extra dose of vaccine in time to get to the people who need it. So the EU's answer is we are ready to do everything. We're ready to help. We're ready to sort of transfer knowledge and high-tech materials in order to get production going in those countries. But we're not really ready to throw out the patents, which might then be just snatched up by China. And that is the main point. And with regard to India, for instance, there is something like an emergency license. The EU countries are ready, I think, to grant one to India, for instance, something that is already in existence for AstraZeneca. They're already producing that particular vaccine in India. So there is a great willingness to help there, but there is not a willingness to be pushed into a measure that then afterwards the European countries couldn't possibly take back.
Okay. Now, Amrita, Prime Minister Modi's government has been arguing for a patent waiver. How important is this to helping India get the pandemic under control?
Eddie, it is extremely important to get this patent waiver, but not just to control the pandemic, because any such waiver would take some time to implement, even if it were to get the approval. But you have to remember that India, along with South Africa, were the two countries who are behind this proposal for a patent waiver, and they put that forward in the WTO last year. Discussions are still going on, and the US President Joe Biden's support for it is a big moral victory for the two countries in matter of principle, because India is one of the biggest producers of generic drugs, cheap, affordable drugs, which are accessible to poorer countries, for example, for AIDS and HIV, when that crisis was there. So India feels very strongly about that. But this summit that we are seeing, the EU-India summit, which is going on in Portugal, is about much more. The prime ministers of the two countries put out an op-ed a day before the summit, and they described this as a profound moment in political relations between the two sides. There's momentum in developing this relationship. They talked about this dialogue being there to recalibrate or rebalance the EU's relationship with the Indo-Pacific. Now, you must remember, underlying all this is another reason why the two sides are coming together, and that can be summed up in one word: China. Both sides are worried about China's increasing military assertiveness, and there are also trade issues, there are investment issues, so they have a lot to talk about. And even though they disagree on issues like patents, they're prepared to deepen their relationship and go further.
Okay. Amrita Chima in Delhi, India, and Barbara Vessel in Portugal. Thank you. Now to some other developments in the pandemic. The EU has struck a deal with COVID-19 vaccine producer BioNTech Pfizer to buy up to 1.8 billion doses for the next few years. The World Health Organization has authorized the emergency use of China's Sinopharm vaccine, the sixth to make their approved list. New York City is planning to offer vaccines to tourists by distributing jabs at Times Square and other attractions.